Hello everyone, a very warm welcome to the Smart RN channel. My name is Henry. Today we are going to start looking at infectious respiratory disorders. And in this video and other videos that are to follow, we are going to look at those infectious disorders that affect the respiratory system and the nursing interventions which are carried out when caring for patients with the infectious respiratory disorder. So let's get started. Now, all body functions require a continuous supply of oxygen. This is because oxygen is required in all the metabolic processes that occur within our bodies. Now, this requirement causes the respiratory tract to be in continuous contact with the external physical environment. Remember, oxygen has to move from the outside through the respiratory tract into the lungs, and carbon dioxide, which is the result of the metabolic processes, has to move from the various cells in the body to the respiratory tract. Now, this continuous contact with the external physical environment exposes the respiratory tract to microorganisms like bacteria, viruses, and fungi. And these microorganisms have caused the respiratory tract to become a common site of infections. Now, to mitigate this, the respiratory tract has got various defense or protective mechanisms whose main function is to try and fight off these microorganisms as well as the infections that might occur as a result of this contact. So we have various defense or protective mechanisms which are in place to help the respiratory tract fight against or fight off these infections which are caused by microorganisms. So let us look at these defense mechanisms which are in place to help the respiratory tract fight off the infections from these microorganisms. Now, to do that, we are going to, as usual, to divide our respiratory tract into two. We have the upper respiratory tract and the lower respiratory tract. Now, the upper respiratory tract offers the first line of defense against microorganisms from the external physical environment. And just as a reminder, the upper respiratory tract consists of the mouth, the nose, the sinuses, the pharynx or the throat, and even the larynx. So let us look at this first line of defense. Now, the nose and the nasal cavities are made up of coarse hair and mucus layer. This one's main function is to filter and trap the particles. As we breathe in the air from the external physical environment, the work of the coarse hair and the mucus layers in the nose and the nasal cavities is to trap and filter out these large or these particles so that they do not get access to our respiratory tract. So this is the work of the coarse hair and the mucus layer is filtering and trapping the particles which might be in this air which is breathed in. And then as we move on in the upper respiratory tract, we have the surface epithelium. The surface epithelium has got antimicrobial peptides. These are like proteins. And these antimicrobial peptides normally exert a bactericidal effect on pathogens. These antimicrobial peptides normally cause or they kill these particular pathogens which might find their way into the respiratory tract. So the surface epithelium contain or they produce antimicrobial peptides which are proteins that exert a bactericidal effect on the pathogens that might enter into the respiratory tract. And then we also have the endothelial lining. The endothelial lining is made up of projections which are referred as cilia. And these cilia normally move in a wave-like motion. This motion is referred as a mucociliary escalator. The mucociliary escalator is the wave-like motion that is exhibited by these cilia. So when these cilia move in that wave-like motion, they try and move the trapped particles to the nasopharynx and the oropharynx. Remember, we said we have got a mucus layer. And if these particles are trapped in this area, the mucociliary escalator motion moves them back to the oropharynx and the nasopharynx, from where they are expelled through the cough as sneezing reflexes. So when we cough, we are actually expelling particles which might have moved into the respiratory tract. When we sneeze, we are also expelling those particles which have been moved into the nasopharynx as a result of this particular mucociliary escalator motion. So the cilia are those wave-like projections which move, there are those projections which move in a wave-like motion, moving the trapped particles back to the nasopharynx and the oropharynx, from where they are expelled through the process of coughing and sneezing. So coughing and sneezing are protective mechanisms which our respiratory tract uses to expel any pathogens or any particles which had entered through the movement of air. Now, at the back of our throats, we also have the tonsils and adenoids. Now, adenoids are lymphoid tissue, and these two normally produce an immune response when pathogens enter into the back of the respiratory tract. Sometimes you might feel that these tonsils are swollen. Now, they are swollen because they are actually fighting off any pathogens which might have entered into the respiratory tract. So the work of the tonsils and the adenoids is to produce an immune response to fight off any pathogens which have entered into the respiratory tract. Then we also have an epiglottis. Now, an epiglottis offers mechanical protection. An epiglottis lies above the larynx. It protects the larynx when we are swallowing. So what happens that when we are not swallowing, the epiglottis is open so that air can enter into the larynx, into the trachea. But when we swallow, the epiglottis lies on top of the larynx to protect or to prevent what we call aspiration, so that any food or any liquid that we are swallowing should not enter into the respiratory tract. We also have the epiglottis. The epiglottis provides mechanical protection against pathogens. So what happens is that the epiglottis always closes when we swallow to prevent aspiration. The epiglottis lies above the larynx. So when we are swallowing, it closes to cover that larynx. Why? To prevent fluid or any water from entering into our respiratory system. And when we are not swallowing, it is open so that air can freely move into our respiratory tract. So epiglottis lies above the larynx. It provides mechanical protection and prevents any aspiration or objects or fluid into the lower respiratory system. And then we have what we call colonization. Colonization refers to bacteria which resides, or is the process through which bacteria resides in the respiratory system. Now, we have got bacteria which is very small enough to cause any infection. And this bacteria is resident in the respiratory tract. Now, we normally call it as resident bacteria or normal flora. Now, this is bacteria in the upper respiratory tract which does not cause any infection. Why? Because it is very, very small to cause an infection. So how does it provide protection against other pathogens? Now, this bacteria normally competes with pathogens for attachment sites. For these pathogens to cause an infection, they must come into the respiratory tract and attach to sites to cause infection. So this bacteria competes with those pathogens for attachment sites. And as a result of this, those harmful pathogens do not have sites to attach onto. And this helps prevent us from getting infections in the upper respiratory tract. Another thing they do is that this resident or this normal flora normally produce bactericidal substances. And these bactericidal substances are those that destroy these harmful bacteria. So colonization is where we have resident or normal flora in the upper respiratory tract competing for attachment sites with the harmful bacteria and also producing bactericidal substances which are harmful to the which destroy the harmful bacteria that tends to come and cause an infection. So those are the protective mechanisms which are found in the upper respiratory system. We have talked about the coarse hair. We have talked about the mucus layer. We have talked about the epithelium, the surface epithelium producing bactericidal substances. We have also talked about the mucociliary skeletal motion of the cilia, which moves throat particles back to the nasopharynx and the oropharynx so that they expel through the process of sneezing and coughing. We have talked about the epiglottis that lies above the larynx to protect any aspiration. And we have also talked about colonization, where we have normal bacteria or normal flora that resides in the upper respiratory tract to compete for attachment sites with the harmful bacteria and also to produce those bactericidal substances that are harmful to any bacteria that might enter our system to cause any infection. So that's the upper respiratory system. Now let us look at the lower respiratory tract. The lower respiratory tract extends from the trachea to the alveoli, and it includes the trachea, the bronchi. Remember the left and right main bronchi. It involves the bronchioles. We have even the alveoli ducts and the alveoli. So this comprises of the lower respiratory tract. Now, the trachea, the bronchi and the bronchioles have got ciliated cells. Now remember those cells that normally provide a mucociliary skeletal motion. These ciliated cells have got cilia, which one provides the mucociliary skeletal motion to bring back or to expel those particular particles which have been absorbed or which have entered into the lower respiratory tract. We also have the mucus producing cells. This trachea, bronchi, and bronchioles. We have the mucus producing cells which physically trap these particles, and then the cilia can move with the mucociliary skeletal motion to try and move these trapped particles back to the larynx and oropharynx from where they are swallowed into the stomach, and in the stomach they are destroyed by various enzymes. So in the lower respiratory tract, we have the ciliated cells which have got cilia, and the mucus producing cells which trap these particles, and all these help to prevent the infection of the lower respiratory tract. And remember, this will only happen if these particular pathogens have avoided all those defense mechanisms which are found in the upper respiratory tract. Remember, we say the upper respiratory tract offers the first line of defense for this particular against this particular pathogens. Now, another thing you have to note is that the lower respiratory tract is meant to be sterile. We are not supposed to have any bacteria in the lower respiratory tract. In that regard, we do not have any resident bacteria or normal flora in the lower respiratory tract. Remember, we said in the upper respiratory tract, we have colonization is one of the defense mechanisms. Normal flora competing for attachment sites with the harmful bacteria and also producing bactericidal chemicals or substances that destroy the harmful bacteria. In the lower respiratory tract, we are not meant to have any resident bacteria or any flora at all. But this lower respiratory tract will only remain sterile as long as we have an efficient protective mechanism provided by the upper respiratory tract. It can only be sterile. We can only have no pathogens in the lower respiratory tract if we have an efficient protective mechanism provided by the upper respiratory tract. But if the upper respiratory tract mechanism is not good enough or efficient enough to trap these particles, then we are going to have pathogens moving into the lower respiratory tract and causing an infection. Now, in the lower respiratory tract, we have what we refer to as the alveolar macrophages. Now, from our previous video, remember we said that the alveoli are those sacs where actual gaseous exchange takes place. Oxygen moves from the alveoli via the alveolar membrane into the bloodstream, and carbon dioxide moves from the bloodstream into the alveoli back to be exhaled outside. So the alveoli is the place where actual gaseous exchange takes place. Now, in that alveoli, we have got what we refer to as alveolar macrophages. These are cells which normally eliminate these pathogens by a process referred to as phagocytosis. In phagocytosis, these macrophages normally engulf these particular pathogens. They engulf them and destroy them physically by that particular process. So in the alveolar, we have got macrophages which eliminate pathogens through the process of phagocytosis. And this is just if these particular particles are able to land, or these pathogens are able to land into the alveolar. So the macrophages will only come into play when the pathogens have avoided all these defense mechanisms and landed in the alveolar. And because that's the center or the place where actual gaseous exchange takes place, the macrophages are going to try to destroy them through that process of engulfing, referred to as phagocytosis. So what happened that despite all these mechanisms, we normally get infections. Why? Because these pathogens are able to go around or are able to avoid this defense mechanism and cause those particular problems. Now, damage to the respiratory epithelium and the large number of infectious pathogens are the ones that will cause us to have a respiratory infection. So a respiratory infection will only occur if we have got damage to the respiratory epithelium. And remember, these are cells which produce these substances that kill the pathogen. So when you have the respiratory epithelium that produces mucus, that produces those bactericidal substances, when these epithelium are damaged, and then when we have a large number of pathogens invading the respiratory tract, then we end up having a respiratory infection. So respiratory infection will only occur when we have got damage to the respiratory epithelium, and also we have got a large number of infectious pathogens which have entered the respiratory tract. Now, for an infection to occur, these four factors must be true. One, the pathogens must be able to avoid the trapping by mucociliary layer. The pathogens that enter the respiratory tract to cause an infection must have the capability or must be able to avoid the mucociliary layer. Remember, this is the layer that contains mucus to trap any pathogens that enter into the respiratory tract. So they will only cause an infection once they have evaded that mucociliary layer. Number two, these pathogens must be airborne. In other words, we must be able to breathe them in. We must be able to take them into our respiratory tract by that process of breathing. So they must be able to be carried out in air. And apart from that, they must be very virulent. They must be able to cause an infection. So the pathogens are airborne and virulent, and that's why we get an infection. Number three, for an infection to occur, the pathogens must avoid phagocytosis. Remember, we said that phagocytosis is carried out by the macrophages, and these are found down in the alveoli. So when these pathogens are able to go up the alveoli and they are able to avoid that phagocytosis, that's when they are able to cause an infection. So the pathogens are able to avoid phagocytosis, and lastly, the pathogens must be large in number. They must be large in number to overwhelm the defense mechanism. So those are the 4 factors that must exist for an infection to occur within the respiratory tract as a result of this particular pathogen. So let us say that the pathogens have been able to avoid all these defense mechanisms and they have landed in the alveoli. They have also been able to avoid phagocytosis. So what happens? Now, when pathogens end up in that alveoli and they have avoided all these mechanisms, we have what we refer to as an inflammatory response. This is a response that involves inflammation. And inflammation is just an immune response to the pathogens which have entered into that particular respiratory tract. Although inflammation can occur anywhere in our bodies, it's just a way of immune response. So in our case here, in our case of respiratory tract, the pathogens have avoided all those defense mechanisms in the upper respiratory system, and also they have been able to avoid phagocytosis. So now they are in the alveoli ready to cause an infection. We are going to have an inflammatory response. Inflammation is going to occur. Inflammation involves swelling. That area is going to swell. We are going to have pain in that area. You're going to feel heat. There is redness and even loss of that tissue function. So this is what happened. When the pathogens are in an area, we have got white blood cells. We have got what we refer to as interleukins. We have the production of cytokines. And cytokines are those proteins like interleukin and tumor necrosis factors which stimulate an immune response. They are the ones that stimulate the immune to be able to respond to this particular pathogen. So when we have these pathogens in the alveoli, during inflammation, we have the production of cytokines which signal the immune system to produce a response. And when the immune system is signals, we have the production of white blood cells. Remember, white blood cells are defense cells. They are the ones that help us to fight off infection. So these white blood cells, or the neutrophils, are normally recruited and sent to that area of infection where we have the pathogen. Another thing that happens is that after the recruitment of these white blood cells, we have got increased capillary permeability. The blood vessels are going to be very permeable. In other words, fluids are able to pass through that particular the capillaries or the blood capillaries. So what happens that when we have capillary permeability, the alveoli where these pathogens are going to fill with fluid and exudate. Now look at this. The white blood cells have moved to that particular region. The capillaries are very permeable. Fluid is filling into the alveoli as the white blood cells are moved. Remember, they're in the blood, so they are being moved to that area to try and fight off infection. So we have got fluid as a result of this capillary permeability, and then we have got exudates which are resulting from the death of some of these pathogens. As the white blood cells fight them, they kill them, we have got exudate, and then we have got fluid. Now what happens that this fluid and exudate provide a good medium for pathogen proliferation. These pathogens like this particular environment. So they are going to reproduce very fast because the environment is very fertile for them to be able to reproduce. Remember, in the alveoli. And number two, this same fluid is going to help in the spread of these pathogens to the adjacent alveoli. Remember, the capillaries are very permeable. Fluid and particles are passing through them very easily. So what happens is, because of this concentration of blood in that area, fluid in that area, white blood cells, that's why we have swelling. Because we have got a concentration of so many particles as the immune system tries to fight off that infection. We have got pain because of these particular particles are exerting on the nerve endings in that particular area. They're exerting and they are pressing against the nerve endings in this particular area. We also have got heat. Why? The temperature in that area is rising, because high temperatures is one of the ways in which the body tries to fight off an infection. That's why when we get an infection, we have fevers, we have got very high temperature. So we are going to have heat in that area generated as a result of this particular inflammation. And because of the because of the blood that is moving that area, we are going to have that particular redness. So inflammation is that process, is that immune response to the pathogen, and it happens through all this particular method. And when we have this pathogen proliferation and spread to these other areas, we end up having an infection. Now remember, all this is happening in the alveolar, and this alveolar is the alveolar is the place where we have got gaseous exchange. So when you have this infection in that area, it prevents this alveolar from participating in effective gaseous exchange. So when we have that infection, and especially in that alveolar, we are not going to have a good gaseous exchange, and we find that these patients are going to have a problem with breathing, and especially are going to experience things like shortness of breath. So that's an immune response that occurs when pathogens are able to dodge all the upper respiratory system defense mechanism, and also they are able to overrun the phagocytosis process in the alveolar. So this brings us to the end of this video. In our next video, we are going to look at the different types of infections or infectious disorders which affect the upper respiratory system. Remember to drop a comment, like this video, share this video, and if you are not yet a subscriber to the Smart RN channel, I urge you to subscribe today. From me here, it is a goodbye.